Good morning, guys. I hope we're all sparkly. Cold water therapy done. Gym session done. What's next? Now, it's safe to say that life sets up challenges, sets up potential obstacles. But we need to see these obstacles as challenges and opportunities. And when you've got low testosterone, with the best will in the world, you can't see the wood for the trees. And you tend to be more negative than you would be with optimal testosterone levels. That doesn't mean you might not be negative with normal testosterone levels, because your mental well-being is far more complicated than having a good testosterone, estrogen, and DHT level. But it is the foundation, as I've said before. If you have the building blocks, then this and the autonomic nervous system has a fighting chance of working with you and not against you. It's never really against you, it's always trying to protect you. But really, we see it as against us because we tend to go into negativity, self-deprecation. Oh, I'm not good enough. I'm paranoid about this. You're not seizing opportunities. You're seeing things as threats. And with healthy testosterone levels, at least you have a fighting chance. It's up to you. It's perspective. You can still see that glass as half empty or glass half full. It is choice. And if consciousness is anything, it's about the subjective appreciation of subtle changes in your physiology. So, choose positivity. Now, it's safe to say the last few years have been particularly challenging. Not only have we had to build up a successful business, medical clinic that now caters to people from 50 different countries, we've had to learn, we've had to adapt. When we first started the clinic, we adhered to the manufacturer guidelines because obviously they're safe, but they're ineffective. And through time, we began to realize that actually more frequent dosing is necessary to achieve stable levels. And then with time and experience, we realized that actually daily dosing is the most effective way of prescribing testosterone replacement therapy. Microdosing TRT, using the minimum effective dose to achieve the desired outcome, which is stable male androgen levels. And the point being to mimic physiology. What is that? How your body functions. So it makes perfect sense to use daily subcutaneous testosterone cypionate injections alongside HCG. HRT, not TRT. TRT is crude. This is not trial and error. This is carefully considered prescribing of a medical therapy in your best interests. Nothing more, nothing less. It's not a USP. Anybody can do it. It is the logical way of prescribing TRT. There are lots of other TRT possibilities, but this is gold standard, baby. I said, we get people come over from America where TRT is everywhere. Why? Because they trust us. They trust me. Sat here rambling in my iPhone, in my Land Rover, having normally been to the gym, having done cold water therapy, having been to work. They trust the education section on the website. If something makes sense, it makes sense. Obviously, we always try and go to the path of least resistance with maximum reward. But I'm not here to sell you anything. If you want to come to the men's health clinic, you will be assessed and judged to see if you're a suitable candidate. It isn't a matter of come to me, come to me, come to me. You can go anywhere you like. There is no sales pitch here. I want the best for you. I want the best for me. And that is what it's all about. We are one consciousness experiencing itself subjectively. And here he goes again. Woo! Off on a tangent. So, what's this video all about? It's about, earning your reward. As I said, it's been particularly challenging. Not only about building the clinic, also, obviously I've had personal stresses and I've had physical stresses. I did my knee, I've got a palsy of my long thoracic nerve. Oh, the list goes on. I've got lots and lots of excuses as to why I'm not a lean, mean fighting machine. But who cares about my excuses? Yeah, nobody. Nobody cares. Work harder. Oh, there. I don't care. Get on with it. Ultimately, it's down to me. It's my responsibility to be better. It's my responsibility to adapt and overcome the hurdles that are placed in front of me and see them as challenges and opportunities, not threats. So, giving up booze, eating clean, I've moved to 1 meal a day. And do you know what? My concentration, my alertness has been absolutely spot on. And I've enjoyed my 1 meal a day. But guess what? I've earned it. And again, ultimately, that's what this is about, earning your reward. Sleep hygiene. Sleep hygiene is incredibly important. So the first part of the day should be activity where you're more sympathetic dominant. The second part of the day should be more parasympathetic, where you're resting and relaxing and hopefully getting a bit of nookie to then sleep. So many people subject themselves to stress until they collapse at night time and they go, well, I sleep well because I'm knackered. It shouldn't be like that. It should be about quality of sleep. And in order to have quality of sleep, the second part of the day should be more relaxing. What can you do? Well, you need to try and set boundaries. How do you separate work and play? Well, I quite like an ice bath because it's an absolute shock to the nervous system. That sympathetic overload then forces you to become parasympathetic. And we need to separate work and play. As I said in the previous video, if you enjoy your work, you're never going to work a day in your life. However, it's a lot of psychological stress, and I've said numerous times before, we are physical beings in a world full of psychological stresses, and we need to remember to be physical. But that doesn't mean being physical late PM, because you're going to stimulate the sympathetic nervous system and cortisol, and that's going to dysregulate your sleep. Life is all about patterns, and if we understand those patterns, we should try and live to the best of our ability according to those patterns for longevity. I want to live long and strong. Where am I going with this? So yeah, super important to look at your sleep. What else? Exercise. As I've said before, just find something that challenges you. You don't have to lift heavy ass weights. Just find something that challenges you physically and psychologically. More often than not, your brain will give up quicker than your body. You are designed to keep going. You are designed for endurance. Our long skeletal tall structures are there for us to cross the plains. We don't need to give up. Giving up, fool's errand, because no benefit comes from giving up, only moving forwards. Stagnating as well is stupid. Whatever you're going to do, do it. Keep moving forwards. So testosterone should give you the foundation to move forwards, but still ultimately, yeah, it's up to you. I can't do it for you. All I can do is help normalize your male androgen levels. The rest is up to you. It's quite bizarre, really. I've become more of a life coach. And do you know what? I'm constantly learning, much like you, constantly learning. Over 2,000 patients have sat in the chair opposite my desk. And all of your subjective experiences are unique to you, but I can tell you hand on heart, from an objective perspective, We are all very similar. We are all on this journey together. Community is incredibly important. Never feel like you're isolated, because you're not. You just have to reach out that hand and do what? Yeah, you guessed it. Go earn your reward.